Greetings, I'm Dr. Beverly O'Brien, founding Dean of the College of Behavioral and Social Sciences at Coppin State University, and your co-host for this podcast, joined by my illustrious co-host, Dr. Harry Legum, who is a full professor in the Department of Psychology, Counseling, and Behavioral Health in the College of Behavioral Social Sciences at Coppin State University. And this is the Coppin Connection podcast. So here we are on the last day of March 31 during the 2021 Women's History Month, and still dealing with a world pandemic. Now just over a year since we went into our virtual existence. And today we're still celebrating women on the front lines of remediation and resolution for this pandemic, who are shattering glass ceilings here at Coppin State University and in the state of Maryland. As always, our Coppin Connection podcast tries to bring up to show you the types of fabulous people here at Coppin State University. And in this last day of March, we want to highlight 3 women who are clearly working on the front lines here at Coppin State University. Who are those frontline workers, Dr. Legum?
Well, they are fabulous, and you are indeed correct again, Dean O'Brien. And here we go. The first is Dr. Tracy Murray. Dr. Murray is Dean and Professor of the College of Health Professions. She is also Director of the Health Center's Coppin State University COVID-19 Subcommittee Chair for Health and Safety. Also member of the Coppin State University COVID-19 Task Force. In addition, Dr. Murray is member of the Maryland Department of Health Community Stakeholder Advisory Group focused on vaccinations. Dr. Murray is also a member of the Baltimore City Health Department Institutions of Higher Learning Committee, and Dr. Murray is Chief in charge of COVID vaccinations at the Coppin State University. Now, ladies and gentlemen, let's talk about Dr. Charlotte Wood, if you please. Dr. Charlotte Wood is Professor and Senior Level Coordinator in the College of Health Professions at Coppin State University. She is also President of the Maryland Nurses Association and member of SARS-CoV-2 Technical Task Force for the state of Maryland. In addition, folks, be ready for this one. Dr. Charlotte Wood is one of the Daily Record's top 100 women in Maryland for 2021. And Dr. O'Brien, you know something about that.
Yes, I do know something about that.
Dr. Danita Tolson is the chair nursing undergraduate program in the College of Health Professions, vaccinator during COVID, and ladies and gentlemen, last but certainly not least, president of the NAACP Baltimore chapter. And now let's turn back over to Dr. O'Brien.
Welcome, ladies, welcome, ladies, welcome, ladies. So what an illustrious bunch on this last day of March. And clearly hard to believe that we are now just over a year in quarantine, well, not quarantine, but off the grid and in virtual life because of the pandemic. And so I thought it very appropriate that we have the 3 of you here today, because you are certainly glass ceiling breakers here at Coppin State University, not only about the things that you have done here at the university, but things that you're doing in the state of Maryland and all in the Coppin community. So let's start with you, Dr. Murray, or Dr. Wood, or Dr. Tolson. How are you feeling about where we are with the virus now? I mean, we're at a point where there are vaccines. We're trying to get people to take vaccines. We have almost a quarter of the United States vaccinated. We're seeing a lot of people who are not wanting to take the vaccine still. We had gone down in positivity rate, and now in some states it's starting to surge. We thought we were coming back up, but maybe we're coming back too fast. Where are we at this point? Dr. Wood, what do you think?
Well, good morning, everyone, and thank you so much for having us. We are currently in conversation at the SARS COVID committee about looking at the different types of vaccines, their efficacy. Most recently, when we met, we discussed the issue of the AstraZeneca and the probability of it getting the emergency approval. There's still a fair amount of hesitancy with members of society. There are some individuals who believe that they should take a wait and see perspective. We want people to be able to get their vaccines when they're scheduled to get them. And I think that as we move forward, the more people that we have vaccines in the arms of, we'll have the opportunity to actually see our community rates go down. And but we just need to be a bit patient, because I think that we're not near where we need to be. Things are moving very, very quickly. And so I think it's a good time for us to continue our efforts in terms of ensuring that we're using all of our basic safety measures.
And what is those basic safety measures, Dr. Murray? How does that flow into this? What do we need to be doing continually?
Good morning. So we continually need to make sure that we are, first off, making sure we're educating individuals about the virus and what's going on. But some of those safety measures include hand washing, wearing our mask, staying away from each other, physical distancing, and social distancing measures.
And we keep hearing that. Just keep wearing the darn mask. I would use like another word, but wear that mask and stay away from one another and do the things we're doing. What's happening now we seem to be in a conundrum where we have people getting vaccinated and thinking they don't have to observe safety measures, and people still afraid to get vaccinated. So it seems that combination of things is not going to work well in the long run, I don't think. What are your feelings about that? And Dr. Tolson, you're doing a lot in the community, and now with your presidency of the NAACP, what do you think about that?
Well, I think that as far as minorities, we need to get rid of some of these myths that's out there. That way we can get more minorities in to get the vaccinations. When I work the COVID clinics, I see the majority of Caucasians coming in. We need to definitely urge minorities to come get vaccinated, and put out education out there so they will know the truth about COVID, the various vaccinations, and be truthful and transparent as far as the side effects and so forth. But they still need to go get it versus getting COVID.
That is exactly right.
I'm sorry, I was just going to say, a few weeks ago, according to the CDC, Dr. Fauci in particular, it was he who stated that we should be continuing to wear our masks until at least 80% of the population, United States wise, is fully vaccinated. What are your thoughts on that?
I definitely agree with Dr. Murray. That is very much so true, is what we need to do. 80%, we know we won't get to 80%. You do see them starting to do more vaccination trials with children. So we cannot get to 80% of our population until we have some integration of some children have to get included in this particular combination. But because it's a respiratory virus, but beyond that, our habits happen to be that we touch surfaces and we and generally touch our nose and our mouth very quickly. And there can still be some minimal transmission through surface and other touch. There are times we just talk to each other. We're aerosolizing when we talk, when we sing, when we laugh, when we're exercising. And so those times that there's particles are transmitting, clearly you can have issues. It seems like such a simple thing that we can do. And because we can do it simplistically, I would just say, wear your mask. Let's get out of this. We don't want to have a setback. And what we do see nationally and internationally is a setback, a backslide. The vaccine has maybe lured some people also. Those people that have think that I don't need to wear the mask. Well, We don't know. It's being researched in real time. So they minimally need to continue wearing the mask until more people are vaccinated, until we can get to the 80%. And then other people still are not vaccinated. Some of it's supply issues and some of it's hesitancy.
So what do you say if now first let me preface my question by saying I have been fully vaccinated and I encourage everyone to get vaccinated. But what do you say to those individuals who are reluctant to get vaccinated because they're saying, well, I don't know, 10 to 15 years down the road, I'm not sure what's going to have an effect, that mRNA component, the mixing up with the DNA. So how does one respond to those concerns?
So I think it's always best to consider the risk versus the odds of the here and now, because COVID now may mean death versus 15 years from now when you may have an impact from something that none of us are quite aware of. However, there is quite a bit of evidence that some of the activities that we're doing are actually having a positive impact on the community. For example, Dr. Murray just mentioned that we can do some very simplistic types of things like wearing the mask. Well, one of the things that is scientifically proven, and we have evidence for it, is the fact that the flu was at its lowest this winter than it has ever been in more than 10 years. We have not had a case of the flu with anyone significantly that have passed. And so we haven't even had cases of the flu because of the mask wearing. So we've started to have dialogue about, should this be a part of our culture that we should encourage beyond the boundaries of the pandemic?
And Dr. Wood, I want to piggyback on what you said, because I also do believe as well, think about the cold. We have seen a reduction in the amount of individuals that have cold. And we also know we've seen clearly a reduction in workplace types of illnesses. But some of that proliferation does occur in workplaces because people are sick and they do come to work sneezing and touching everything. And then we have transmission and it goes around throughout particular areas. So this particular strategy of the mask may have been one that should have been integrated previously and could have helped others who had flu or other types of illnesses that are respiratory in transmission, especially during winter and other periods of time, to have decreased some of those laws. And we need to begin to look at a lot of the literature and the research that's going to come out of this to see, should we be doing this strategy as we continue, especially for those that are high risk areas or high risk populations, so we can have an impact on cold, flu, and this pandemic that we're in, other variants that are going to come with this pandemic, and any future pandemics going forward.
That's a very good point. And as you think about it, when we talk about going back to normal, most people realize that normal will not be the same normal. It'll probably be a new normal. And there are times in the past when you think when people being sick, every once in a while, you'd see someone with a mask on who had a cold, or we used to teach people to cough into their elbow. Used to be your hand, then it was your elbow. But now, because of this pandemic, some of those things that seem to be atypical behaviors, like putting on a mask, are becoming very typical. They have become normalized. I mean, there's a mask to go with pretty much anything you want to put on if you're fashion sensitive. And so I can really see that mask wearing will very easily become a part of the culture. If you are sick, you will come to work with a mask if you are well enough to come, but sick enough should stay home. You will cover yourself. And I think the other part of it is, I heard a gentleman on the news the other day. He was an African-American male and about 65, 70. And he had just come from getting his shot. And he said, I have friends who don't want to take this. So they think they need more proof. He said, can't figure out what more proof they need. There are 500,000 people dead. What more proof do you need that you need to take this shot? And while you understand, while minorities and underrepresented groups are fearful, And I think the politicization of this early on exacerbated that. The reality is that being sick is better than being dead. And though, as you just pointed out, Dr. Wood, with the vaccination, it assures you of not dying from it. It at least you may become sick at some point in time, but you will not die from it. And if anyone's seen those new diagrams that they're showing on the lungs, when the ones that's COVID filled and the ones that aren't, you can clearly see how breathing becomes totally impossible.
I do want to say,
is
Dean O'Brien,
Also,
I just
Dr.
want to
Murray?
add that there is there's the percentages. So with the vaccine, they are effective with disease severity, but each vaccine has a different percentage. So most people will have no impact on, deaths, and they will be able, they might be hospitalized, but most people maybe won't be hospitalized, but there will still be those that still have comorbidities, because this does highlight the issues of health disparities. There will be those with health
Correct.
disparities and comorbidities that may have a more increased risk, because it's not any of them that are 100%.
can I also add that the asymptomatic people that are spreading? So if you
Yes.
decide not to wear the mask and not wash your hands, and you asymptomatic and you're spreading it and not knowing that you have COVID. So it's very important to continue to wear the mask and wash your hands, as Dr. Murray and Dr. Wood stated. And also looking at the elderly population, if you're asymptomatic and you making them, susceptible to getting the COVID-19.
Yeah, that's a very important point, because there are many people who are asymptomatic. I mean, the old as well as the young. And being asymptomatic does not mean you don't spread it. And so, regardless of how you feel about it, if it's not about you, it should be about others. I mean, your own family, parents, and friends. So it is quite something. So
Can I add a question or go back to you
Mhm.
said about people that are hesitant or not wanting to get the vaccine? So I wanted to speak personally myself. I have a history of allergies. And because of that, so I want to relate this to anybody who's not or who's hesitant. I myself also was concerned because I have a history of allergies with some reactions. And so the main thing of it is, and so one of my allergies happens to be allergic to the sun, as an example. So the point is that, but it doesn't, nothing in my allergies don't close my throat down. So certainly people who have the throat closure, that's a little bit different. But what did I do? I spoke to my physician and wanted to make sure, were there any things that they thought that I should do to take additional precautions based on that and the health information that was currently available. But I also was able to read the literature myself and look at a lot of the data components and be able to assess what would be in my best interest. So I think that you can see that there's enough information. I actually received the Pfizer vaccine on Friday, but that some people may need to look at their health history information and get a discussion with their healthcare provider. And I think that that's acceptable. You will always have early adopters, middle and late adopters, and there may be a different why for every person, why they decide to actually get the vaccine. But as was stated, you know what, you don't want to get in a hospital. And if you can avoid death, if that's what it is, and you can be here with us, then, it's about getting that vaccine.
And once we attain or become fully vaccinated, you get this white card, and the white card has the date that the person's been vaccinated. So my recommendation is, I'm just wet behind the ears here, but my recommendation would be to take a picture and put it in your phone, and in addition, maybe get it laminated.
Right. And
That's-
that we are doing that.
That's a great idea, because actually very recently, President Biden has spoken on the fact that he has pulled and started to pull a group together. Certainly there's some states that are objecting to it, but he's giving some consideration to a vaccine passport. That's been talked about for quite some time now. And since day one of the vaccination clinics, we've encouraged individuals to hold on to their cards because we don't know what the end outcome may be. There may be a requirement that the card has to be presented at the airport. There may be a requirement that the card is presented at the movies, for example, where you have large gatherings, or at the baseball games, where people know that if you're in an environment where others are fully vaccinated, that you would be at least in a safer environment than you would be if you were not vaccinated at all. So you're right, Dr. Legum. You really need to hold on to that card. You need to laminate it if you can. If not, take that photo of it with your phone. And we recently had 2 individuals in the COVID clinic that I've been in recently, last week and this week and the week before, that these individuals were 103, 105, and they were really cute, because what they said is, what more proof do people need to get the vaccine than someone who's lived this long, but is
And still want to.
is willing to leave their homes, go out in the public, take this vaccine, and ensure that what more life they have to live, they can live it without having, an impact from the COVID disease process, and live a very quality life. So
That's exactly right. And
it's been very interesting.
I was
Yeah,
thinking about as we move forward with in terms of the identification cards that we receive, having gotten the vaccine, it's really not unusual as we start to move back to traveling, especially out of the country. Right now, you have to have a vaccination card to go to certain countries, period. And as time went on, you needed certain information to get back into your own country. And so it's not so unheard of that we could actually need to be carrying these cards just like we carry a driver's license or a passport. And I also wanted to go back to the point that Dr. Murray was talking about earlier, and that is the reason people have hesitancy about things. It's nothing wrong with questioning things. One should question things. You should always get a second opinion. And I, interestingly enough, Dr. Murray and I were talking quite some time ago, and before the vaccines, and I remember thinking, well, I'm already in 2 categories right off the bat. So I already have a pre-existing condition in age. So I figured, well, I know I have to get it. But I listened to a lot of other things, and it was kind of scary. So who do I start talking to? My colleague, Dr. Tracy Murray. And Dr. Tracy Murray starts talking about her hesitancy with her allergy. But the only thing that really made me do was go investigate it further. It did heighten my concerns. But when I started reading the literature on it, number one, it changed my mind. And then I went to my doctor as well. And in this heart sec, before I could get anything out of my mouth, he said, take it. I mean, he didn't really listen to what I went, take it, period. And that was the end for me. But I think you need to at least put yourself at rest with it. And that was earlier on when the vaccines were just coming out. Because honestly, in my head, I thought, I'm gonna wait for the second round. That was in my head. It was in my head. And it was all politically based. And I know that because I don't think that's normally what I would have done. But I'm fully vaccinated now. Everyone in my family is fully vaccinated. Even my grandson just got vaccinated. And so I am ecstatic about it. I'm happy about it. And as Dr. Wood just said earlier, before we started, he said, we celebrate. How did you put that, Dr. Wood?
We celebrate every arm.
We celebrate every arm. It's important. We celebrate every arm.
And there's something to be, which we haven't mentioned up to now, but that emotional component. Now that we're fully vaccinated, naturally we're going to wear the mask, we're going to do the social distancing. But for me, I just feel a lot safer.
Mm-hmm. I remember watching my daughter after she got it. She took my husband and I, because it was a weather day, and we thought it was going to snow. So she took us in her Tahoe, knowing we would get there in time. And they took her as well. She didn't have a vaccine. It was the end of the day, and they took her as well, which is something else people need to know, that those vaccines need to be given all of the doses they have. And so oftentimes, even if you don't have a vaccine, if you're there, there's no one else there, and you haven't been vaccinated, they've been vaccinating people. But I talked about the emotions. When she got that vaccine, when we were sitting there in the observation area, her giddiness about the whole thing was like she just won $1 million, and she was so excited about it. You're right. The emotional security that overwhelms you when you know that you're done. Part of it is probably some of the intrepidation you have before you go. And it's not that anybody's just rearing ready to go get a shot anytime anyway. And some people have different reactions, emotional reactions to getting a shot. But when it's done, the calmness that comes over your body, I mean, even though we still have to adhere things, it is an emotionally charged event. You feel so much better.
And there's an old expression, as if I'm a great grandfather here, but there's an old expression that, you can't put a price tag on such and such. Well, I think this is one of the components or categories that exemplifies that expression.
That's right. You can't put a price tag on this.
Can I go back to what you said about the those cards or being able to use your cards? There are some concerns, though, clearly for civil liberties being violated. And so that would be the downside of that. But one of the things what you're seeing, some people are taking off their mask and other aspects that may be even in state mandates but they're kind of fraudulently indicating that they have received the vaccine. So it does appear in some ways that there's going to have to be some type of validation when, like you're saying, if you're going to try to bring mass groups together, because people are trying to verbally validate that they have completed the vaccine, the same way like some people deny symptoms, that they have COVID symptoms, and they try to pass through barriers. And sometimes you can't tell if people have symptoms. Sometimes they wait for you to test them, and then, you tell them, well, you're positive. Say, oh yeah, I had that symptom. But the other thing is that with this vaccines, there's going to be that validation needed because people are not being as open because they still want access, but they may be hesitant about the vaccine. And I personally can relate to my mother, who I know she really is excited about being able to go to church. So everybody has also, and be social with people again. So there's certainly reasons why people do want to have the vaccine. I'm also proud to say at Coppin State University, they've opened a call center. And at that call center, because some things have been that people don't have, we take for granted that people have access to technology. So Coppin State University is using the older system of just call us. And by calling, then the people that they reach at the call center will make the appointment for them.
I'm glad you went there because I did want to talk a little bit about Coppin State University because thanks to our leader, Dr. Anthony Jenkins, and our COVID-19 task force, of which you are a member, Tracy, as am I, honestly, the College of Health Professions has really led the way on our university in terms of ensuring that vaccines are available and given. I'm not sure how, between you and our IT department, I don't know how any of you are still standing actually after a year of this intensity. All of you are to be truly commended. But talk a little bit about what we have done at Coppin State University, because even though we are primarily virtual, we have had some on-campus presence, and our positivity rate has remained low. And we're now looking at possibility of having a in-person commencement, albeit only students, but that's just wonderful. I know that they're excited about it. But talk a little bit about where we are on our campus, things that we've done on our campus to get through this over the last year.
Well, I would first like to have Dr. Tolson talk about what we're doing as relates to our students and vaccines, and then we can talk about other strategies that we're using as well.
Hey, Dr. Tolson.
Well, I want to thank the students for participating.
You're breaking up, Dr. Tolson.
That was part of their clinical experience. So I scheduled at the beginning. Okay, started out initially doing it every day during the week.
Dr.
At the
Tolson,
beginning,
Dr. Tolson, we
yes.
missed the beginning of what you said. We're having a little virtual interruption here. What could you begin again? Because we didn't hear the beginning of what you said.
Okay. At the beginning, we started vaccinating early in January, and we vaccinated every day for Monday through Friday from 8:30 to 4:30. And then now we're only vaccinating on Wednesdays, but the students are actively participating in the vaccination clinics. They are vaccinators, they are fillers, they are, just helping wherever we can. But we've been actively participating from day one when Baltimore City Health Department contacted us.
Wow.
And I
These
thought
are
it was
college
a great
students, right? The students of the College of Health Professions who are actively vaccinating.
Absolutely. And then we have the nursing faculty and other volunteers that decided to jump in. Everybody wanted to be a part of history because that's what exactly is happening. Along with that, they also are getting their clinical experience by being able to give injections and communicate and delegate and having a human connection and just talk and assess the people that were coming in, communicating with the physicians because the physicians had to look and see if the person had anything or any health concerns that we had to wave the physician down to come check them out, which determined if they waited for 15 minutes or 30 minutes in the observation side. But it's a great experience. I encourage all the nurses, if you can participate. They know this is my passion. Dr. Mary, I think, I don't know if she knew, but I'm definitely enjoying this, when we decided to work on this together. So great experience. The other thing I want to add on was, I know y'all talked about the cards, but we also have an Immunet where if you lose your cards, you can go to your physician or health department and they can pull up when you have gotten the vaccination, the COVID vax. They will document or have it on the internet when you got the first vaccination and when you got the second vaccination.
Oh, that's
so
good to know.
That's
you
important
know
to
that
yeah.
there's documentation now for pretty much all immunizations in the system.
And that's a national effort.
Correct.
Yes.
Wow, that's
It's
great.
Immunet, and it keeps MMR, the measles, mumps, rubella, flu, whatever vaccination you have, so you can get that and pull it up.
Oh, that's wonderful.
Would you happen to
I
know
also want to
the website for that?
What did you say, Harry?
the website.
For that, yes.
Okay, you have to go to your physician or
Okay.
health department, or if you go into patient first or so forth, they will document and then provide that documentation to you.
Okay.
They'll give you the
Yeah.
internet site, you mean, in order to look it up?
Typically, it's a part of their physician portal.
Correct.
Oh, I see.
Typically, it's a part of their physician portal.
Okay,
But
okay. All right.
the state has a documentation system that Dr. Tolson was referring to as Immunet. They record, and that's how we validate when people come to us, sit down, and say they want to be vaccinated. If this is I forgot my card. Is this your first or second dose? And they say it's their second dose. We can literally look them up by name, birth date, age, gender, address, and determine whether or not they have received that first dose to ensure that we are giving them the correct second dose, because we don't cross vaccines. Vaccines, if you received Moderna and got your first dose Moderna, you're going to get a second dose of Moderna. If you receive Pfizer as a first dose, you're going to get a second dose Pfizer. And when we get all the Johnson & Johnson doses in, you will get one dose of Johnson & Johnson.
Right.
That's critically important. That is critically important.
Can I also add, oh, excuse me, go ahead, Dr. Wood, you want to say?
No, I was just going to say that we even gave some consideration when we were talking at the state level and just brainstorming, like which would be the best group of individuals from a population standpoint that should actually receive the 1-dose vaccine, as opposed to those that could receive the 2-dose vaccine. So they didn't want to put bias into it, but clearly there are groups of people who need the vaccine, who you may not see again. And so the best thing to do is give that population of individuals as best you can the 1-dose vaccine, which is a Johnson & Johnson. For example, maybe people who might be homeless, or they might live in a shelter, or they're transient. There are a number of reasons why we would want to target, hopefully, and not necessarily target per se, but look at them as a risk group that we want to ensure that they get their vaccines and not be left out because they don't have permanent residence.
Well,
And I do want to add.
Dr. Murray and then Dr. Colson.
Well, we both want to add something, but I want to say this, that as it relates to the homeless population, Lord Baltimore is used as one of the sites that's used, but there are many others that through the governor's initiatives that they have created strategies for those individuals that are homeless to be able to work with their other health issues as well as COVID related issues. But going back to what else is Coppin doing, I want to say we're using a very holistic approach. It is not an approach based on one or few people. It touches every division on the Coppin State University. Our task force is organized underneath the president, President Jenkins. And then ultimately, even in our health and safety subcommittee, we have people from facilities, we have people from events planning, we have people from human resources, we have faculty members, staff and student, but people that are from each college that are represented. And we really want the diverse viewpoints of individuals because it makes it very comprehensive. We also have individuals from athletics. We've done some strategies for putting like fit testing for athletes to help to reduce the risk, especially when they are on a bus. That was done 2 faculty members, Hines Jackson and Dr. Harvin. We've had individuals who bring things forward to us, like whether they're trying to do something in a dance class or a science class, and we've tried to create those strategies to make me very effective. We've sought the input of our staff to see what are their viewpoints, what are their concerns. And we looked at some things such as face shields integration and also the sneeze guards as well. So it's a very holistic approach. There's so many strategies that have been implemented, but they have all been implemented in conjunction with our faculty, staff, and students.
I appreciate that because it really has been a campus-wide effort and everyone's energies and thoughts have been taken into consideration. Dr. Tolson, what were you going to say? You don't want to say it anymore? When you go in and out, when you cut your sound off, for some reason it stays off.
About people vaccines. Well, vaccines.
Ladies and gentlemen,
I wanted to say that people that have come in for their first vaccinations, I had conversations at the COVID clinic where we're seeing a decrease, as we were talking about people returning, as Dr. Wood was saying, and Dr. Mary. People are not returning to get their vaccination. So when we first started out, we were vaccinating like 300 people or 300 or more people a day. And then, it slowed down. Why are they not coming back for the second dose? So I actually saw this for my own self. Mind you that they could be going to other sites, but we were just tracking, them coming back.
Well, now that's an interesting point though. What happens if you don't come back, if you don't get your second dose? I mean, you're not fully vaccinated if you don't get your second dose. What are the ramifications of that?
It impacts the level of efficacy that is associated with the vaccine that you're receiving. So if you don't come back and become fully vaccinated, the efficacy that you hear with these vaccines being 95% versus 96% versus 86%, that level of efficacy goes down exponentially if you don't receive your second dose, which lends itself to you being more vulnerable and more at risk for
catching COVID.
potentially having increased severity with the illness that you may have if you come in contact with someone that has COVID-19.
Mm-hmm.
And of course, among the 3 vaccines that are currently active, with the Johnson & Johnson being included, that's one of the criteria. First of all, you take what you can get at this point, but is it a 2 vaccine or 2 shot deal, or is it just that 1 shot deal?
Mm-hmm. So
And you take what they have.
Right.
And that's what I would encourage anyone who has an opportunity to get a vaccine. And I even spoke to my children and said to them, my daughter was saying, Mom, I have to drive 2 hours to be able to get the vaccine. I said, you have to do what you have to do, but you have to get that vaccine.
Mm-hmm.
So I was telling her, I've been fully vaccinated for over a month now, but now you're slowly but surely starting to hear some of the potential outcomes of, those individuals who got it really early on, or they were a part of the trials, and you're getting feedback from how long it might last, how long it may need to be in your system, how long it stays in your system. So we are starting to get some data relative to that. And so we don't know the whole package. So it's probably best not to speak on that piece too much, but it will reveal itself over the next year as to the total effectiveness in terms of not effectiveness against the disease itself, but how long the vaccination lasts within your body, and you are protected at that 95 or 96 percentile level. So,
and I think it's important for people to continue to be forthcoming and open about that, because the realities are still that this has been developed in record time, thank God, because the death rate would be far higher than it is. And fortunately, they have been able to do that so that people don't start questioning all over things that don't need to be questioned. I mean, we know that we are going to be over time seeing how things work, how long it will last. Right now they're already saying that we'll all probably need another booster at some point after this, and we do what we need to do. And if you think about all the vaccines that have come around in our lifetime that people forget about, we give children vaccines at birth, that there was a time that wasn't there and people were dying. Polio, all the things that we have gone throughout time, we just happen to be living through one. And at no point in our history has anything been developed to a point to show you how far medicine has gone, where they could do something like this within a year to get it accomplished and into the world. And yet there are still places in the world that don't have the vaccine.
Well, let's just say it's not been a full year. This research,
right,
because you think about SARS.
Mm-hmm.
SARS was prevalent before, but it goes back to these coronaviruses. And then there was MERS as well. So the undercurrent and the underpinning of this research has been present for more than a year. I think the way that it was projected may make people be concerned because it says warp speed. However, the research was already present. That's why they were able to get it activated so quickly for many people.
Mm-hmm.
And I think that's why we have to be concerned about messaging and how we say what we say to the public, because that is one of the things that make people so anxious. Or it can provide a level of confidence that people have in what we do and how we go about doing it. So I think in terms of Dr. Mary and the backdrop that she just added to the issue of how long historically this has been going on, it really provides a level of definite, confidence that this didn't happen just because of the issue that surrounds the immediacy of COVID-19.
Mm-hmm.
And again, I thought most important, again, goes back to that documentation, record keeping, because as you as previously stated, we do not know how long in terms of the effectiveness, long-term, short-term of the vaccine. So that's why it's important that we have records to document that so that going forward, if the vaccine's only good for a year and a half or what have you, at least you can use that as a guide to move forward.
And so anybody who gets the vaccine, what they should do or they're encouraging to do is to sign up after you have the vaccine to be included in what they would call the monitoring. And including that monitoring, then you could indicate, did you happen to get any symptoms, but you also can indicate, did you happen to get a COVID infection any point in time? And that's how we're going to build the database of information. And so this is being, analyzed in real time because we will have 1 year of data, which would be in 2022. And then they can make more decisions when you start looking at these different populations that are being unvaccinated over time.
Mm-hmm. Agreed.
So with that, I'm going to thank my guests so much. This conversation could go on and on and on, but Dr. Wood, you ended on the note that I was going to end on, and that is that messaging is critically important, and the right message can clearly give people a different comfort level. It gives them a better understanding of things, and I appreciate all three of our guests today who have clearly given the right messages and kept it straight, and point out that these are Coppin women. They are all doctors and excellent in their field, all engaged in the community as well as at Coppin State University. And we salute them in March in Women's History Month. And to also say that Dr. Murray and I will be working on messaging, and we're looking forward to that. And so I want to thank everybody for being with us today. And we will probably see you again, because this issue of COVID and vaccines and getting the message out to all the right people, which is the world, but getting them the right clear messages is important. So we're very pleased about that. And with that, I'm going to say to everybody, along with my co-hosts, that we thank you for listening. We want you to tune in next month, where we'll continue to talk about our Coppin Proud moments. And until then, stay positive, test negative, be happy, stay healthy, enhance your educational status, whatever it is now, and consider Coppin State University as a way to enhance all three. Peace out.